Hi, today I'm going to talk about frequently asked questions about gallbladder surgery. So, as everybody knows, the gallbladder is removed as a part of infection in the gallbladder or formation of stones in the gallbladder. So, unfortunately, only option to treat gallbladder infection or gallbladder stones is removal. This will be usually done through a keyhole surgery, either laparoscopic or robotic. So, what will happen after removal of gallbladder? So, generally, we consider this as mainly a storage organ for bile. Removal of the gallbladder will not hamper in any way in bile production, or it will not interfere with the metabolism of the fat. So, it will be basically done by a bile which is produced in the liver. So, we usually don't expect any long-term effects of removal of gallbladder. However, initially as a part of surgery, we advise not to take too much of fatty foods or non-vegetarian food immediately, like 1 to 2 weeks post surgery. Apart from that, all other food habits can be managed. So, can I resume office after gallbladder surgery? See, we usually allow the patient to walk around and be mobile after 6 hours of surgery. However, we allow the patient to drive after 3 to 4 days, and he can start work from home immediately discharged from the hospital and can resume regular office work after 3 to 4 days. Since the gallbladder surgery is done through a keyhole surgery, we usually don't expect too much of pain from the hospital. However, minor discomfort will be there that can be very well managed with pain medications. However, initially only we advise restriction in food intake in terms of taking non-veg or fatty foods for only 1 or 2 weeks. There is no long-term restriction in food intake because the gallbladder removal is not going to affect metabolism in a longer run, and people can have a normal healthy lifestyle after gallbladder removal surgery.